The Trump administration's MAHA report on the health of America's children is out today. For the most part, it tells us things that we already knew, that American kids are eating too many processed foods, that they're not exercising enough, and that they are being exposed, to pesticides. The report from HHS, the agency led by Robert F. Kennedy Jr., also promises to look into the negative effects of vaccines. Joining us now, senior correspondent for Vox, Dylan Scott, who has been reporting on the MAHA movement, and critical care physician, professor of pediatrics, and a board member at the School of Health at Georgetown University, Dr. Michael Anderson. Thank you, gentlemen, for joining us. Dylan, walk us through what this report says.
Well, thanks for having me, Katie. As you say, this primarily, focuses on the subject areas that we would expect based on the first MAHA report, based on RFK Jr.'s rhetoric in general. It talks about ultra-processed foods. It talks about microplastics, vaccines, fluoride, the smorgasbord of issues that have all come to fall under the Make America Healthy Again tent. I think what is interesting about the report is its action items are primarily calling for further research, calling for data crunching based on some of the data sets that the federal government already has access to, and basically the production of new information, new reports to kind of pin down exactly how some of these things are negatively affecting children's health. And I think in that respect, it kind of encompasses everything that MAHA has come to encompass. You've got some things in here that are extremely mainstream, whether it's, improving food at school, in public schools, whether it's making it easier for grocery stores to open up in low income areas, doing further research into how environmental toxins affect children's development. I think those are things that a lot of people would agree on. And then you also have things in here like a pledge to revisit the childhood immunization schedule, to potentially revamp the vaccine injury laws, to look more at fluoride and the damage that it is allegedly doing to people's well-being. Those are some things that I think are well outside of the medical mainstream. And so MAHA has kind of been living in both of these worlds. I think we see some places where the report decides not to go too hard on, for example, pesticide companies. That's been a really high profile issue where RFK Jr. has been outspoken about it in the past. The MAHA groups are really fixated on it. And yet, other parts of the Trump administration that are outside of RFK Jr.'s control, like the EPA, have been taking more of a deregulatory approach. Yeah. And so the MAHA report, while it name checks pesticides, doesn't exactly propose aggressive new policies about how to regulate them. So, yeah, in a way, it's sort of an encapsulation of what MAHA has come to represent so far, and it without trying to disrupt, some of the internal dynamics in the Trump administration.
So what's interesting is that many members of the MAHA movement feel very betrayed and angry that pesticides were not gone after more strongly in this report. Let me just play, to set the scene, what RFK Jr. said as he introduced this report.
Our girls are hitting puberty 6 years earlier than historically. Our young men have sperm counts that are half of what they ought to be. They have testosterone levels that are half of what they ought to be. We have diabetes that is now endemic, not just epidemic, it's everywhere.
I'm hoping, Doctor, you can help me untangle that. I think what he's saying is, girls are hitting puberty sooner. Sperm count is an issue. There's been lots of reporting on this. Diabetes is an issue as well. The diet of American kids, not great. How is that, though, being used? Or are they really addressing those problems? Or is that stuff being used to say, hey, listen, the entire medical establishment can't be trusted, vaccines can't be trusted, and the only thing standing between you and being healthy is the American Medical Association or the American Academy of Pediatrics, Big Pharma, et cetera?
Yeah, at the core, on behalf of America's pediatricians, if I could be so bold, we want kids to be healthy too, right? We want them to exercise more. We want them to have healthy foods. We want them to be in a safe and loving environment with good schools. All of that is core to who we are as pediatricians. But two things are also really important. Number one, we need to rely on science, on rigorous science to define outcomes. So if there are things that need to be studied, let's talk about them. Let's figure out what the studies are. The third element, however, which is core to pediatricians, is we need to keep children safe from vaccine preventable illness. And I've been around long enough to have seen kids die of varicella complications, to see kids die from Haemophilus influenza B. These diseases are almost completely wiped out of America because of vaccines. Vaccines do not cause autism. That has been shown time and time again. Vaccines cause adults. Vaccines cause kids to be able to go through life and hit their full potential. So, I think pediatricians are struggling, families are struggling, and that's why you do see organizations like the American Academy of Pediatrics. I've been a proud member for decades now, stepping up with their own vaccine schedule because they know how life-altering these vaccines can be in a very positive way.
Well, speak to a parent or speak to a society that looks at our kids and says, what's going on? They're not healthy. They're not as healthy as they should be. Help them understand how to become more healthy when they are being advertised unhealthy food, when the food they get in school is not healthy, when the cheapest food is the unhealthy food. When you try to eat healthy, you have pesticides or whatever. Like, how do you help parents understand that the problem is not the vaccines, the problem is not the American medical establishment, the problem is what?
You've said it so well. There's lifestyle things. Our kids have become couch potatoes. Our kids are now on screens so many hours of the day. They're not as physically active. And you're right, walk into a convenience store, what's the cheapest thing? It's a bag of chips, right? As opposed to an apple or something. So we do have incredible work still ahead. It comes down, at least for me, for a conversation between that family and their pediatrician or their family medicine doc. Let's talk this through. How can my child get healthier? What about this whole vaccine hesitancy that families are feeling? I think it's important that physicians and scientists speak out, and I'm very proud of how my fellow colleagues have been doing that. But Katie, at the end of the day, it comes down to a conversation that families have to have with their trusted provider. Hey, doc, give me the science. Give me what you think we need to do as a family to make sure this beautiful child has a healthy life.
Yeah, and you got to feel for parents, because if you're talking about food in particular, try going anywhere with your kid and not hearing a demand for chips or for ice cream or for a treat, and then a wail and a struggle on the floor when they don't get it. I mean, it is.
Look, honey, difficult. I got you an apple. You got me a what? How'd you get me an apple? How dare you?
Try a banana. You're going to like it. No, I want the Doritos. I get it. Right. Doctor, thank you so much for joining us. Dr. Michael Anderson. Dylan Scott, thank you as well for joining us today.